Sitting down with Dr. David Klein of the Stages of Life Institute, suffernomore.com, and stagesoflifevitamins.com. Let's talk about lack of sleep or sleep deprivation and chronic illnesses, and also those that may suffer because of on and off shift work.
You betcha. Okay, and this is a big, big deal. We're seeing an increase in the amount of chronic illness. I mean, an alarming increase in diabetes, an alarming increase in weight issues, depression, anxiety issues in our kids, teenagers, and so on and so forth, to the point where it's now a public health emergency. So what is it that's causing this? And they're arguing, well, it's the internet. Oh, well, it's the television. You remember when it used to be the television? You'd watch too much television, you're gonna become feeble. I mean, honest to God, some of the stuff that we were told was absolute idiocy. But something magical happened in the 1990s, 1990, 2000, and then all of a sudden, all hell broke loose with regards to chronic illness. You're seeing just an acceleration in weight issues, diabetes issues, depression. The list keeps going and going and going. Something has changed, and I've been preaching this for about 20 years. Get the cell phones away from the kids, take them away from their pillows, get them out of the bedrooms because it's keeping them from sleeping. If you keep somebody from sleeping, they'll become depressed. If they become depressed, their blood pressure goes up. Diabetes, obesity, a lot of things follow. Well, wouldn't you know it? Article last week in Journal American Medical Association is looking at circadian rhythm disorders and chronic illness. Now, in day-to-day public terms, what this means is individuals that don't get an adequate enough sleep have an increased risk of high blood pressure, cancer, diabetes, obesity, and a whole bunch of other disease states. Wouldn't you know? Sleep is important. Benjamin Franklin, he's on one of our bills. He still is on one of our bills, in spite of the fact that we're tearing down everybody else's statues. Nobody's gone after him yet. Go figure. He's like the original Bill Clinton. Nobody has gone after this guy yet. But what he said was early to bed, early to rise will make a man healthy, wealthy, and wise. He was quite correct. Okay. Now, why is this? Well, it works a little something like this. Okay. Your body is geared to follow the clock. Okay. When the sun goes down, when the lights dim, okay, the birds go to sleep for the most part. Owls wake up, but for the most part, all the rest of them go to sleep. Bears are out there prowling, lions are out there prowling, but the number of nocturnal creatures is really far less than those that operate during the day. We are daytime creatures. That is the way we operate. And if you eat too late at night, if you don't get adequate sleep, you take your medications too late, or if you find yourself waking up in the middle of the night, wouldn't you know, your risk of weight gain, your risk of diabetes, your risk of depression, your risk of high blood pressure increases rather dramatically. Now, why do you suppose this is? This is not a joke. This is not an old, we used to call them old wives' tales. You really can't use that expression so much anymore. I don't know why. It worked then. But it works a little something like this. Your mama told you this. Okay, now we're good to go. Okay, she was right. Why is sleep important to you? In spite of the fact that it got you out of her hair for a while, it's that the body goes through certain house cleaning, circuits. It goes through these cleaning cycles, as it were, that are necessary for health. Your computer does this on a regular basis. It defrags itself. We understand more about our computers than we understand ourselves. When you're sleeping at night, when you're supposed to be sleeping at night, your brain is going through certain biochemical changes that are necessary to maintain your endocrine health, your immune system health, as well as your general health. Now, how would you prove this to yourself? This sounds like a bunch of hokey. Well, back in the 1950s, there was a war. Okay, it was called the Korean War, and the Chinese kind of got involved with it because we got a little bit too close to their border, as it turns out. And a bunch of our GIs were captured. Well, go figure. So they developed an interrogation technique called the Chinese water torture. And then this goes back over 60 years. Okay? And what they did was using a simple drop of water onto the forehead. It drove people crazy. Okay? They would admit to anything. They would be convinced that they were Chinese themselves if they were so inclined, because deprivation of sleep will make you crazy. And how long does this take to occur? Anywhere from 3 to 4 days, you start to become irritable, depressed. After about a week or two, you become profoundly depressed. After 6 weeks of sleep deprivation, you become psychotic. With absolute sleep deprivation, you can die. Very, very simple. It is that dramatic of an effect on the system. So why do we care about sleep deprivation? Okay, well, there you are. It's 9 o'clock, 10 o'clock at night. The lights go down. The sun is depressed. And you and yours are staying up at night watching the late night show. Okay, for starters, it's pretty useless anyway. It's not very funny. Okay, but in the process of doing this, you're changing your own circadian rhythms so that cortisol secretion, which is supposed to occur between 3 and 6 in the morning, starts to be delayed or suppressed. Testosterone secretion, estrogen secretion, 150 other hormones just from your adrenals alone get suppressed, and then pretty soon you start to get sick. What about the poor guys that find themselves getting up in the middle of the night to pee? Okay, prostate starts to get enlarged because as you get older, estrogen levels go up. This too seems to be getting worse with time. Back in the day, men would get up once, go to the bathroom, that was considered abnormal. Now, if somebody only gets up once at night, it's not unremarkable at all because of the way that our bodies are changing as a result of the way we are forcing ourselves not to sleep at night. So how much sleep are we supposed to get? This is sort of an interesting question. The answer is 10 and a half hours. How many people get 10 and a half hours per night? And the answer is very, very few. All right. So, well, if you can't get 10 and a half hours, what's the next best? Okay, that's kind of like, if you're going to get shot in the head, what's the next best caliber to be hit by? It works a little something like this. 8 to 8.5 hours is a minimum. Okay, when you start getting less than that, you're going to become less and less efficient and less healthy. Very, very important point. Your body has to go through a certain number of REM cycles. I'm not getting too technical. It's a period of time where your brain goes to sleep more profoundly, okay, than it does at other times. You go through a series of waves. It's a lot like the ocean, except a lot less frequently. So you may go through 3 of these waves every night. 4. The more you go through them, the better you're going to be. This is when you dream, oddly, okay? So when you go through REM sleep, the brain also kicks out through the pituitary gland something called growth hormone. Now, that is very, very important. And if you're a weightlifter, one of these narcissistic folks at the gym, they absolutely go nuts over growth hormone. They'll go out and they'll buy it out of China, pop themselves with growth hormone, start looking like Cro-Magnon Man, because apparently to some individuals that's attractive. But you can do this yourself by simply going to sleep adequately. A little bit of growth hormone is very, very healthy. A lot of growth hormone taken at the gym is not very healthy. What does this do to the immune system? As you find yourself sleeping, you become healthier and healthier. So again, going back to the day, how do you prevent illness? How do you keep yourself from getting sick? And the answer is going to sleep. Staying out all night, drinking and partying is a guarantee to make yourself sick. The joke is, they were right. They were spot on correct about this. So how do you get yourself into a normal sleep cycle, you might ask? Well, I've never been a good sleeper. Yeah, you've trained yourself not to sleep. Now it's time to take your time to train yourself to do it properly. The very first thing you need to do is understand the nature and the science of sleep hygiene. What does this mean? Sleep hygiene means what do you do to keep the body going in the right direction? For starters, when you go to bed, the TV is out, the lights are out, the windows are blackened, no light, no sound, nothing, and go to sleep. Not sit there and read, not sit there and watch television for half an hour, not watch the news, but you go to sleep. If you want to watch the news, you do it out in the living room, you do it in the dining room, you do it in the TV room, it used to be called, but someplace other than the bedroom. The second thing you do is don't eat later than 7 o'clock at night, because if you do, you're going to start developing heartburn when you try to sleep. The body's digesting food when it's not supposed to be digesting food, and it will wake you up. The third thing is not drinking alcohol after 7 or 8 o'clock in the evening, or you're going to go through mini withdrawals that will wake you up. These things are important. With regards to interventions, I typically start with melatonin. Dosage is between 5 and 20 milligrams at bedtime. Start with 5 to 10 milligrams, double it if you have to. L-theanine is an amino acid. It's present in turkey. The stuff is marvelous to make you sleepy. The dosage there is 200 to 400 milligrams at bedtime. 5-hydroxytryptophan, another one very, very helpful to trigger and initiate sleep. Most importantly is get blood work to find out what your cortisol level is doing. Because if your cortisol level is too low, you will not stay asleep. And staying asleep is really what this thing is all about. If you find yourself waking up in the middle of the night, you're going to need to do something medical about this, and this is going to require some intervention. But sleep cycles are wickedly important. Get on it. Understand that your life depends on it, your health depends on it, your longevity depends on it.
SufferNoMore.com, SufferNoMore.com. And if you want to get on a good regimen of nutraceuticals, that's as simple as joining up with Stages of Life Vitamins.com. And here's more contact information.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.